Good afternoon, ladies and gentlemen. First, I'd like to thank a lot for Professor Book, your invitation. So we are old friends for many years. So thank you so much for the excellent meeting, the whole arrangement. It's today, this afternoon, Chinese case. We have two presentations. Okay, both. I suppose I have two slides, one today, one tomorrow. It's fine, maybe changed. So we do know that to the complex aortic arch, sometimes the case is very challenging. So what should we do to the challenging cases? I do believe that it should be done individually. Of course, in China, we emphasize the handle procedure is very important to the challenging cases. For the cardiovascular surgeon, we usually do open surgery, but everybody knows the total aortic arch replacement, we do need at least 3 to 5 hours. The mortality is very high. But anyway, nowadays we have the hybrid procedure and the procedures. So let's take a look at the data in Fuai Hospital. Just 2025, we have the aortic cases, it's nearly 2,000. Our open surgery still occupies the large ratio. Let's take a look at the ratio in the whole aorta. We find it, aortic arch is nearly 25%. More and more cases are ascending aorta, nearly the aortic root. So let's take a look at 2019 in Fuai Hospital, the procedures for the aortic arch, the patients, the ratio hybrid occupies a lot. But nowadays, more and more cases to be done by endo. So that's a whole handle procedure for the aortic arch. We divided the handle procedure. We emphasize the hybrid aortic arch repair divided into 4 groups. We organize different countries specialists discuss. Finally, these 4 different types almost included nowadays all the procedures for the whole aortic arch, including the type 1, type 2, type 3, and type 4A and B. So to such cases, the most simple procedure just perform the debranching for the ascending aorta, then add a stent graft to the whole aortic arch. It's a simple method for the doctors, especially in the local hospital. So we needn't use any other procedures. So you can just do directly, you needn't stop the heart breathing. So just do it, control the blood pressure to get a very good result. Then the type 2 is well accepted in China now, especially in many medical centers. Cardiovascular surgeons like to do this procedure. Just replace the ascending aorta, then add another stent graft to treat the patient. Especially to the acute aortic dissection, it can really decrease the mortality and the complications. Then we have the type 3 hybrid procedure. This one also is well accepted in China. It can avoid the acute ischemia of the distal organs and the limbs. So such kind of cases at the beginning in China, we usually do the hybrid procedure, but nowadays we say we will never do hybrid now. We will do it totally by endo. So we have the endo repair for the challenge cases. We can use a blunt stent graft, we can use a chimney, we can use a filtration. Let's take a look at the data in Fuai Hospital. 2023, we have more than 200 aortic arch reconstruction totally by endo. We find it. The fenestration occupies a ratio is more than 15%. But as we compare with 2024, we find it more and more patients will be done by blanch staining graft. Then the chimney and fenestration reduced. I suppose this year and the next year, more staining graft by blanch staining graft to the whole aortic arch. The chimney technique, although is very, very old technique, not too old, among its 20 years, but it's really useful. For example, many different kind of cases can be totally done by chimney technique. We already finished more than 1,000 aortic arch reconstruction by chimney plus snorkel to how to net the branch vessel, the branch staining graft in the right position, how to allocate the space inside the aortic arch is really important. Also, we have the special design staining graft, the longit, to prevent the endo leak. So this special designed staining graft is made in China by LabTech. It's designed by me, my patent. So we finished the multi-center investigation. Also, from the animal study, it works so well. The multi-center investigation, we do it, including the first human, to get a very good result. So this device gets the CFDA approval. Now it's in the market. No matter in China and in Asian countries and the European countries, even South America, our specialists already use it to treat a patient. So that's a result for the longit, the device. This device is very simple for you to deploy, just like the chimney, but it can prevent, can reduce the endo leak type 1 from 10% decrease to about 3%. So it's very useful. Now, many people use it very freely, especially to the challenging cases. Sometimes, if during operation you perform TIVR, you cover the LSA or cover the left glory in case, then you can use a longit staining graft to save the branch vessel. It's more simple and easy. For example, such kind of cases, before we had to do hybrid procedures, but you will use the total endo procedure is very simple and easy. So that we use a caster. We combined the single branch staining graft with a longit. It's much better for you to rebuild the two branch vessels. Also, the operation time is very quickly. So the different kind of combination with a staining graft. So you may find this one, you can find it. The waist artery is involved, the aortic arch. But anyway, we deploy the device and you can get the very good result for the two branch vessels. This one is also, we use a skirt staining graft to rebuild. Sorry, cannot working. Another technique we'd like to say is a fenestration. The fenestration is well accepted in China, not only in vitro, but also in situ. We have done more than 1,000 such kind of cases by on-table fenestration. The most simple method is use a self-radioplaque marked physician-modified fenestration. So this device contained an 8 on the big cave, also contained a supporting bar, a 0 in the small cave. So you can release partial staining graft, then make a fenestration, then reassemble the device within 5 minutes. You needn't situ any marks. It's very freely for you to do it. So we use this technique to rebuild, to perform the reconstruction of the whole aortic arch very freely. So we emphasize the aortic arch cannot be exist severe toxicity. If the aortic arch very smoothly, you can use on-table filtration to finish the procedures. We already use this technique in different countries. Everybody like it. So we do it in recent 10 years. Almost all the cases we finished, no severe complications, no mortality. Every time we transfer the life case from China to the United States, to European countries, to South America, each time, one branch vessel filtration within half an hour. It's very quickly. So you may find we do it like this way. You can use this technique to rebuild two branch vessels only one puncture area from the femur. You needn't dissect the carotid. You needn't dissect the branch vessels. So even the three branch vessel, if the whole aortic arch is very smoothly, you can do it directly. The whole procedure from the first angiogram to last angiogram is within 1 hour, very quickly. Also, we need only one exercise from the femoral artery. So this one, you can find it. We use filtration technique to preserve it, to get the very good result. We combine with a snorkel and chimney with a filtration to do individually for all patients. We already published people talking about this technique, so you may check it. Till now, more than 1,000 cases by filtration to get the long-term follow-up. So the branch vessel keep patterned. The ratio at the beginning or finally are very nice. So that's the device we use it to do in situ filtration. If the aortic arch exists severe angulation, we can do in situ filtration. We use a special device, use a bone puncture needle, or use a bonding puncture system to do it very freely. We also invent the C-skirt, the special device, including the big stent graft. On the big cave, more graft, less stent, and the branch vessel, we snap the C-skirt. We also combine with a special system. That's a whole system is already approved by the CFDA. Last year, it came available in the market. Nowadays, some Asian countries and European countries already use this device to do it. So we may find it. This device is the ideal device to perform in situ filtration. It's only the legal device for you to do it. So we have done the multi-center investigation in China. Also, many cases nowadays to be done by this special device. You may find it, no matter how severe the angulation of the aortic arch, even the balance of climbing artery, type 3 aortic arch, we can do it very freely. So that's a follow-up of the C-skirt. We find it, the technical success is very good. Also, the branch vessel patency is perfect. So the branch stent graft nowadays in China, we have Castor, we have Gratas. So you can use this device to treat the patient. It's also combined with filtration with this device. So you do it very freely to get the very good result. That's a combination with in situ and in vitro. Finally, we emphasize still some cases, especially for the genetic reasons, we have to perform open surgery for the patient. For example, we have the hemi-arch replacement, we have total arch replacement, we have frozen elephant trunk combined with total arch replacement. So in Fuai Hospital, among our cases nowadays, although the ratio of the open surgery reduced, but anyway, it's still very useful to the very challenging cases. For example, if the patient's the pathology is coming from genetic, so the first option is still the open surgery for the patients. So that's a whole procedure for us to do for the patients who suffer from the aortic arch. pathology. Thank you so much for your attention. Thank you.